In this session, we will discuss Bear tract retinopathy, or as it is known by another name, grouped type pigmentation. This entity should be considered a variant of CHIRPY, although there are some subtle histological differences. In recent years, there has been some confusion and controversy about this lesion, as some have suggested that this condition is related to colon cancer, as are the lesions found in Gardner syndrome. We'll discuss this later. Here's a typical picture of Bear tract. The lesions are round or oval, and they are 0.1 to 0.5 disc diameters in size. Usually, they are found in only one quadrant, but occasionally, as in this patient, the lesions can be found in several quadrants. Some authors suggest that the larger lesions tend to be more posterior and the smaller lesions more peripheral. And this gives the appearance that the bear is walking from the nerve towards the periphery. While these lesions do not look like typical Bear tract, they can be considered as a grouped type pigmentation. There's also another variation that are albinotic spots that Dr. Gass referred to also as group type or Bear tract, and he did describe this in his atlas. There are a few reports that show that this pattern of grouped pigmentation may be familial because it can run in families. And there have been some genetic mutations found. However, we don't know if these genetic mutations just happen to be associated with this fundus picture or if they're actually causative. Now, as mentioned earlier, there are some reports that grouped type pigmentation is associated with colon cancer, as in Gardner's syndrome. However, Shields et al. Studied 132 patients with CHIRPY, Bear tract, and group type pigmentation. One patient had intestinal polyposis, but no cancer. Among the 2,000 relatives, only 20 had polyposis or colon cancer. Now that is only a 1% incidence, and it is far less than expected if these lesions were similar to the lesions in Gardner syndrome, which are highly associated with colon cancer. In summary, Bear tract retinopathy or group type pigmentation is a benign condition. Some reports have shown a familial component, and there are some rare systemic associations. No specific genetic changes have been associated with this pathology. Histologically, the lesions have some minor differences with typical CHIRPY. The pigment granules have the normal ellipsoid shape, and the RPE cells are not hyperplastic as that found in CHIRPY. And finally, while some reports have mentioned an association with colon cancer, Shields et al. In a large study did not find that association.